My name is Nancy Gowan, and I am excited to have over 100 people joining us today. We will be sharing with you some of what we've seen in 2021 and some statistics and some lessons for what we'd like to do going forward in 2022. As we go along, we welcome you. As I said before, we have left you on mute so that everyone can hear the presentation. Our recording can be clear, and we can make sure that we have this recording available to others who can't join us today. If you have a question, please make sure that you have the ability to, oh, what do we got? A gray screen? Is that better? Okay, so I think that was the chat box. So what I will do is I will go in and out of the chat box and check later on as I come to questions. So I might not be able to take a look at the chat box as we go along, so we can get a nice clear recording for you. You should have received the slides or the handouts just about 30 minutes ago, so that you have those to be able to take some notes. And let's get started. If you would like more information following this session, go to any of our online stores at gowanhealth.com or gowantraining.com, or contact us at gowanhealth@gowanhealth.com, so that we can provide you with additional information, and we can give you more resources to help you with your health and productivity needs. We do have some great online workshops coming up. Everything's virtual these days, as you're aware. We have our public training sessions for manager mental health starting February 17th, 2022, and we'll be offering those every couple of months over 2022. So take a look at that if you'd like to get your managers trained around how to support employees at this difficult time. We also have our live virtual CSA, Work Disability Management Standards training on March the 1st, and then several online programs like our Cognitive Demands Analysis Certificate Program, Mental Health and Return to Work, Complex Accommodations in the Workplace, Psychological Safety at Work training series, Working Hybrid series, and Psychological Health and Safety program. So check out gowantraining.com and our store there for anything that might help you with your health and productivity training and needs. My name is Nancy Gowan, and I'm an occupational therapist and a certified disability management professional. Over the past 30 years, I have helped employees and employers work together to be able to stay at work and return to work. I'm also an international speaker, trainer, and author of the Human Resources Guide to Managing Disability in the Workplace. I want to tell you a little bit about Gowan Consulting. Hopefully all of you are quite aware of who we are. We've been in business for 23 years. We have Canadian-wide occupational therapy services that focus on functional ability and work, ergonomics, accommodation, stay at work, return to work, mental health support training, and policy development, as well as the workshops that hopefully you've had an opportunity to attend. Our focus is to make the complex simple and to work together for your healthy business. We know that staying at work these days, returning to work, all of the concerns around the pandemic have made things complex to be able to help employees from a distance or through coming into work as essential workers. Our job is to help you, to help your employees be healthy and productive. So welcome to Groundhog Year 2022. Yes, it is a challenge for sure. This 2022 started out making us feel like we were back in 2020. Lockdowns have occurred, schools going back online, all kinds of challenges that we've dealt with in 2020 are seeming to come back again in 2022. And so much of what we're seeing is going to maybe sound familiar to what we might have recommended last year, but we're hoping that we can move through 2022 and be back online, back into our workplaces. When we take a look at our concerns around what's causing health benefit claims, what are the highest percentage of claims, over the years that has changed. So in 1961, our biggest concern was heart attacks and neurological conditions. In 2011, musculoskeletal disorders and mental health were the highest claims. In 2020, when we talked to you last year, it was mental health and musculoskeletal disorders. And now we're seeing infectious disease and mental health in terms of our highest benefit claims when we're looking at short-term and long-term disabilities. When we look at what are the absences that we have occurring over the workplace, I have somebody raising their hand, so let me just stop for a second. Okay, let me see. Can you see the slides now? Sorry, all of this technology. Okay, so hopefully as we proceed along, you'll start to, I'll just hide the floating controls. There we go. So as we go through absences per year per full-time employee, what we're seeing that over the past few years, the number of sick absences for your full-time employees has gradually increased. In 2017, 9.6 days per employee per year was lost because of sickness absence. You'll see that that has gradually increased, so that in 2020, it peaked at 11.6 absence days per employee per year. And in last year, it went down just a bit to 11.1 absence days per employee per year. That's fairly significant when we start to take a look at the amount of cost of absences, people being away, and coverage. But it's not a surprise based on what we've seen with the COVID-related absences. During the COVID-19 pandemic, the cost of working while unwell has emerged more clearly. So according to the Occupational Medicine Journal in 2021, issues related to sickness absence and return to work have become more crucial for employers and employees alike. Probably don't have to tell you that, but there's two major definitions. When we start to look at presenteeism and people being at work, what we're seeing is the sickness absence, sickness presenteeism, and impaired work function presenteeism starting to be defined differently. So sickness presenteeism is going to work when you are ill, when you are unwell, when you're unable to function. Impaired work function presenteeism is when someone's not properly accommodated. They could work if they had the appropriate resources, the appropriate accommodation in the workplace. So much of the research that we've seen around being away from work due to sickness or to disability has meshed together the sickness presenteeism and impaired work function presenteeism. With what's happened in COVID-19, we're starting to see that individuals are being asked to stay at home when they're ill. But we are seeing a number of individuals trying to continue to function with anxiety, with mental health concerns, with inability to focus. And so trying to piece apart, is this a sickness presenteeism or is it impaired work function that we are dealing with, is something that you as an employer might want to take a look at. When we start to look at disability in the workplace, Statistics Canada in December 2021 took a look at how many employees, workers with disabilities, had claimed CERB. And so the CERB payments were paid to about 35% of individuals that had disabilities. So among the 2.6 million Canadian workers with disabilities, 35% of those individuals had been laid off and had received CERB payments. I think that's fairly significant as we start to talk about the importance of impaired work function and accommodation and helping people to stay at work where possible. It also speaks to individuals who may have been in employment settings that were no longer, so the service industry, the retail industry, those industries that shut down, many individuals with disabilities would have been accommodated in those workplaces, but they were shut down, and then that increased the amount of CERB payments for individuals with disabilities. The types of disabilities, so workers with disabilities who receive CERB payments, so 40% were physical disabilities, 33% sensory disabilities, 41% cognitive disabilities, 36% were pain-related disabilities, and 38% mental health-related disabilities. So it helps us to take a look at those individuals that may perhaps have better opportunity to be accommodated in the workplace, but because of that COVID, because of the workplace that they were in, they may have been laid off and were not accommodated, where in fact it was easier to have them collect CERB payments, or they were in a situation where they hadn't gotten the appropriate accommodations to stay in that workplace. We also take a look at mental health as a serious concern. So the Canadian the Addictions and Mental Health organization did a regular survey throughout COVID to take a look at how our mental health was doing. And so the latest survey completed in January 2022 showed that anxiety levels are still increasing, that depression levels are increasing, our loneliness levels are increasing. The one positive thing is a reduction in the binge drinking levels, that people are perhaps finding other types of coping strategies. So as we take a look at the CAMH 2022 survey and look at since May of 2020, where are those levels? This graph shows you the level of anxiety. So that in May 2020, it was just at 31.2% for individuals aged 18 to 39, and it's peaking again at 33.5%. So we see that when anxiety levels have perhaps reduced, that with this resurgence of Omicron, that we're getting an increase in anxiety levels. We are also seeing an increase in depression levels, higher than we've ever seen during COVID. And so that talks to us about the importance of having good mental health services, access to support for your employees. When we look at Statistics Canada, they compared, and the Statistics Canada is a little bit farther behind the CAMH surveys, but a larger population. So the age group of over 12 years, they took a look at how many individuals perceive their mental health as fair to poor. And we see a gradual increase from 2019 to 2020. We don't have a 2021 or 2022 amount from Statistics Canada, but we do see that increase in people having fair to poor mental health in terms of their perceptions. We also saw that the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction did some surveying and some research, and they provided us with additional data to demonstrate that our young youth, that 45% report moderate to severe anxiety symptoms, and 40% of those who use alcohol or cannabis report that increased use over the past month and a reduced ability to handle pandemic stress. And that was from December 13th, 2021. So we're seeing that the young adults, the youth have very high levels of anxiety, very high levels of depression, that there's still a perceived stigma towards depression, and even more prevalent for alcohol use disorders. Also, through this summary report from the Mental Health Commission in May 19, 2021, up to 1 in 2 individuals with an existing substance use disorder reported having moderate to severe or severe symptoms of depression since March 2020. That 1 in 2 of the respondents to this survey showed current mental health symptoms using individuals using cannabis, and that use of cannabis increasing compared to 2 in 5 of the general population. So 50% of individuals with mental health symptoms were using cannabis. 1 in 3 were using alcohol. Moderate to severe anxiety symptoms were the highest among respondents with lifetime substance use disorders and lifetime mental health diagnoses. And that the top stressors were financial, social isolation, and the health of family members. So many of these statistics might not surprise you from what you've heard over the pandemic, but we want to be able to take a look at using some of this data to reinforce the importance of having good mental health support. This Statistics Canada survey from January 2021 looked at what's the reason that you have increased consumption of alcohol or increased consumption of cannabis. And stress and boredom and loneliness were the top reasons for utilizing substances. And interestingly enough, convenience. So individuals not having regular scheduled work, were at home more often. There was more access to alcohol and more access to cannabis. Not something that you'd see someone using alcohol coming into the workplace, but because we're working from home, that convenience of use, the substance use increased. Again, suicide risk, we've talked a lot about that the increase in individuals with suicidal ideation has been significant, that in October 2020, it increased to about 10% of the population that had indicated that they were thinking of suicide. When we did look at the suicide numbers, it is actually looking like we have some intervention for suicide, that more awareness to get help for suicide may be assisting us in reducing the number of suicides in Canada, the completed suicide rate, that it has declined to 9.3 per thousand, and about the 9th cause of death in Canada. still a very significant number when we look at those individuals completing suicide. But when we look at the suicide ideation, we are hopeful that some of the interventions that we're doing around mental health are helping individuals to get the care to come forward to talk about those concerns. So what are our top 10 2022 strategies? As an employer, what are we going to do to help with the health and productivity of individuals in our workplace? So I'm going to zoom through this and talk about those top 10. 1, we need to develop a strong psychological health and safety program. This was our #1 last year as well. We know from Deloitte's research in 2018 that there is a significant return on investment for investing in a strong psychological health and safety program. So getting $2.68 for every dollar spent after the first 3 years of your psychological health and safety program. The cost of doing nothing, we filled in those number of sick days per year into our analysis category. We increased, the number of employees that were reporting presenteeism. And now an organization that is about 2,000 employees are experiencing absences, presenteeism issues at a rate of $138.9 million per year. And so that is fairly significant in terms of the loss of productivity and health for your employees. I'm happy to put your organization and your numbers in our calculator if you want some help with your specific numbers, but these are general numbers from the research that we're showing. What we're seeing is burnout is real. After 2 years of experiencing this pandemic, a recent study that was published by the Mental Health Research of Canada and Canada Life on January 17th, 2022, shows us that burnout rates are above the national average of 35%. That our nurses, our mental health professionals, our first responders, transportation, finance, legal, insurance, education, and childcare are all experiencing well above the national average of 35% when we look at burnout rates. This is significant to those employees' capabilities in staying well and being able to perform their jobs. But in our workplaces, what can we do to help and support? We also have lots of information about presenteeism. Manulife's 2020 wellness report reported 45% of employees surveyed said that their health problems affect their productivity at work. In another global study where employees reported taking an average of 4 days of sick time per year, also admitted that they were at work and unproductive 57.5 days per year on average. And 16% of working hours, which equates to about 40.8 days per employee per year, were lost due to health-related absences and presenteeism. So what's burnout? Well, it's that body's fight, flight, or freeze response that we've had going for over 2 years. That increase in needing to respond to those over and over crises over this long period of time. That our burnout is arising when individuals can't access enough recovery between stressors. So we've been going for 2 years on fight, flight, or freeze. And in doing that, we're trying to step to the next stressor and deal with it, but our body is not getting that recovery. When we look at what causes burnout, unsustainable workload. This is the work at home as well as at work, trying to balance childcare, trying to balance work activities, trying to get things done. having lack of control over this crisis, insufficient reward. We're hearing lots about individuals needing, more finances to be able to do the level of work that they're doing, getting rewards to say that they are making a difference, lack of a supportive community, absence of fairness, where essential workers are continuing to work, others are at home and not able to work, and being mismatched in terms of what we value and our skills. So we've seen a lot of that mismatch of values and skills in terms of the vaccination policies, the issues around being able to be at work and what's required may not be meeting some people's values now, and that's causing some burnout. So we need to start to listen to what our employees are saying, that everyone comes to work to really meet their needs, to meet their financial needs, to be able to have that career, that development, that recognition. But when there is too much that's being asked of them and not enough time, when there's no fairness, when they're being asked to do jobs that they may not have had good onboarding and good training about, or they're feeling unsafe, or not even getting that belonging. So when we used to feel belonging by going into the workplace, we're maybe not seeing that we matter as much. And this is leading to burnout in our workplace. So the steps to your psychological safety, you want to take a look at a culture review. Where is your organization today? How are you able to support employees? What is your leadership doing to support employees in the workplace? Have you looked at workload, expectations, the tools that individuals are using to be able to get their work done so that they can be supported? We may need to adjust what our expectations were of getting that work done. Boundaries between work and home need to be looked at, as well as considering the safety, both psychologically and physically, of your employees. Can your employees voice their concerns? Can they come forward and feel comfortable to let you know what's not working? And can they ask for help and support in a safe manner? We have some tools to assist you with your psychological safety in your workplace. We have a psychological health and safety consultation and guidance process. We have some videos to assist with psychological safety in the workplace for your employees, and some online training. If you're interested, you can check that out at our gowantraining.com store. Number 2 lesson, inclusive leadership for 2022. Over 65% of new managers indicate that they do not feel that they have the skills and training to create an inclusive and supportive workplace. That's from a survey done by Forbes in 2021. The top challenges that they're facing as managers today are uncertainty about the future, well-being of their employees, tracking team productivity, shaping company culture, recruiting and onboarding the right employees, supporting diversity and inclusion in the workplace, managing communication, regulation, technology, mind skills gaps, high staff turnover, creating innovative teams, breaking down silos, the knowledge loss and brain drain, and engagement. These are the top concerns and challenges that many of your managers and your leaders are facing today, and need to find some strategies to help them. And so we've participated in that Bell Let's Talk Day, but what can we do to continue that process? Many of you probably saw this video from Bell Let's Talk about the importance of just being there and of listening. I'm going to quickly show that video just to reinforce the importance of leaders listening to employees today.
I'm listening.
I'm listening.
listening. Mommy's listening.
Listening. I'm listening, Dad.
So we thank Bell Let's Talk for these continued promotions of mental health in the workplace, but the importance of leaders knowing how to listen, knowing how to engage employees to be able to support them through these challenging times. And as leaders, having the skill set to manage their own mental health and emotional intelligence so that they can support their employees. So it is important to train your managers. As we said, 65% of new managers feel like they don't have the skills to be able to do inclusive support of your employees. Training managers on how to listen with empathy, attention, and respect. Listening for the reason why an employee might be burdened or concerned, and working together to find solutions. Really discussing the expectations in the workplace, discussing the expectations of the employee, and how we can have the right resources, policies, and actions that can help your employees to stay healthy and well through this difficult time. This truly is a significant skill set that managers can gain by having the right training and support. We do have our manager mental health training program that we're offering to managers over the next few months. If you have managers within your organization where you want a customized training program, we can provide you with manager mental health training, inclusive leadership training to be able to support your managers in having the right strategies, tools to be able to support employees through this very challenging time. Number 3 lesson, we need to provide improved resources for employee flexibility. Resiliency is important, but we need to, as an organizations, provide the right tools to help employees have the ability to balance their well-being with the workplace challenges and home challenges. Integrating workplace balance and support and mental health is so important to your employees. We've seen high staff turnover and a skills gap created by the Great Resignation in 2021, where employees have left organizations because they're reassessing the meaning of what they can do, how can they balance this. And when we look at employees, what are they looking for when they come to us, when we're recruiting, when we're onboarding? They're looking for roles that allow for flexibility, allow them to balance their mental health, their work, and their home life. How do we maintain these skills? Because we've seen an increase in baby boomer retirements, parents leaving the workforce, individuals making a choice to resign because of the challenges of not having flexibility in the workplace. So what are some of the tools you can use? Well, employees have indicated that they're looking for the availability to adjust a planned workday to respond more urgent matters in the workplace or at home. Beginning to navigate whether a traditional 40-hour work week or even a 37.5-hour, 5-day-a-week work schedule is appropriate. We've seen Zorro Township implement now for all their employees a 4-day work week. Is that something that might work for your organization? Allowing employees to work nights, weekends to help them to manage the burden of weekday childcare and other obligations. Let employees stagger start and end times based on their unique schedules. Be accommodating to employees' work style and personal needs. Do they need other accommodations or adjustments or ways to be able to work so that they can be more productive? Give employees autonomy for their work and trust that they'll perform well in their job and meet the expectations. And recognize employees individually based on their accomplishments and also how they prefer to have praise in the office. Are these some of the things that you've already implemented perhaps in the last couple of years to offer flexibility? I remember 2 years ago when we talked to employers about individuals with disabilities, the accommodations being needed, work from home, adjust work hours. We now need to manage this for the whole work population. How do we allow for more flexibility in the workplace and the ability to manage both work and home together? It is important to understand that during the workday, during the work week, and 24/7, there is a need to recharge batteries with resiliency activities. How are employees encouraged to take their breaks, to go for a walk, to be able to implement meditation and mindfulness in the workplace? We've implemented a regular mindfulness program for our employees so that they can build into their workday a morning meditation. We've encouraged employees to take their breaks, to go for walks. And we've engaged employees with social as well as work-related discussions. So wellness challenges and activities. There are many different ways to build in resiliency, but reminding your employees to do these activities is important. But also as an employer, building the structure and building the support within the workday to implement these types of activities are very important, because employees don't have time after work. They're going to other childcare activities. They're going to do homeschooling. They're doing so much in their other hours of the day. How do you help to give them the structure to build in these types of resiliency activities as part of their work? We know that the research shows us that those individuals that take regular breaks, that implement these types of strategies during their day, are in fact more productive. There are some helpful resources available out there to help you to build that structure and support into your work structure, including your employee and family assistance program. Implementing virtual coaching sessions with occupational therapists to take a look at how each employee can build their self-care plan, as well as online government-funded resources and other training programs. The fourth lesson is providing success coaching by an occupational therapist. We are finding that many managers are talking to us about employees that are responding in the workplace with behaviors that may not be related to mental health concerns, lack of skill in communication, lack of ability to balance that work life. And so offering success coaching can lead to retention of your valuable staff. If you offer the access to a practical, work-focused, cognitive behavioral therapy approach from an occupational therapist, that proactive on-site support can help employees stay at work, to develop skills in communication, emotional regulation, interpersonal skills such as conflict resolution, and facilitate successful team interactions and management of team behaviors. OTs or occupational therapists are ideal mental health professionals because we have knowledge of the workplace, We're not just talking, but we are activity-based, strategy-based, skills-based to give you sustainable tools for your employee to be successful at work. And our focus is work-focused, evidence-based strategies to be able to help your employees to be successful in doing their work and balancing their home life. We have a tips for return to the workplace for those people that are anxious about anticipating return to work. We all are feeling that big, awkward concern about getting back into normal living and normal life. And so it is important for us to continue to develop those strategies and skills with your employees. Lesson 5, we need to support diversity and inclusion in the workplace. Over the past 2 years, we've seen an increase in awareness of the importance of those individuals in our workplace and in our community that have been racialized, that have systemic barriers, that have kept them from getting the access to healthcare, getting the access to workplaces, and the importance of having a structured DEI program process to help employees to feel included, to be able to participate fully in the workplace is so important. We've seen the impact of COVID on inclusivity, that race does matter, that microaggressions are happening and systemic barriers occur that are keeping individuals from being able to actively participate and engage in their workplaces. We're seeing varied impact on COVID on racialized communities where individuals are experiencing less access to the care that they need during COVID, vaccinations, access to mental health care. And we're also seeing a need to redesign our supply chain, that we're seeing that some of the inclusive concerns are leading to a change needed in how we ensure that individuals are able to participate fully and provide the goods and services that are needed across globally. We have always seen that microaggression, systemic barriers, and COVID-19, that individuals in racialized communities have been isolated, have experienced mental health challenges at a higher level than other individuals. And so it's important that we help to create a process to reduce the systemic barriers, to allow people to be able to access our workplace in the way that is best for them, in the way that is meaningful and allows them to be healthy and safe to participate fully. It is also important to take a look at then our harassment in the workplace complaints, being proactive. This arbitration decision that came out of BC, the Human Rights Tribunal, indicated that an employer who had received a harassment complaint by an employee did not deal with it proactively, and in fact, had the employee continue to endure discrimination, the employer was then found to be unable to provide the appropriate reduction in discrimination and harassment. And the tribunal found against the Goodberry Restaurant Group that they had not implemented appropriate harassment investigations and not dealt with things in a timely manner. So the timeliness of your dealing with harassment complaints is important. We do have some tools around inclusive leadership training, unconscious bias and inclusion employee training, and support for inclusion through accommodation for persons with disabilities that you can take a look at. Our sixth lesson is, how do we get engagement when we're not in the workplace together? Some of the tools that we recommend are regular check-ins with coworkers and managers, scheduling think time, get off Zoom, have space for innovation and creative space. Being on Zoom and in meetings all the time does not allow employees to be able to engage and create. Have more water cooler replacement discussions, fun social gatherings, the ability for individuals to have virtual challenges together. Use creative technology tools for gathering engagement, and really pay attention to your pulse surveys and taking action on those quickly. Ensure that ergonomic workstations and habits are in place. It looks like, whether it's a hybrid workplace or more lockdowns, that working from home is going to be a part of the future. So it is important for you as an employer to ensure that your employees have the appropriate ergonomic workstations and habits in place. We can provide virtual ergonomic assessments from a distance, being able to provide employees with good decisions. You may have some good policies in place to indicate that employees can purchase ergonomic equipment, but if they don't know what to purchase for themselves and for their workstation, you may find that they have increase in aches, pains, and injury. And so it is important for them to be guided through this process. Engaging in a virtual ergonomic assessment can help them to find the right tools for them. Or we have an ergonomics tip line. So we can provide your employees with access to ergonomics professionals online, on the phone, virtual, access to a quick setup, decisions about why am I feeling aches and pains, and supporting that, dealing with early intervention on those discomforts. So contact us at Gowan Health at gowanhealth.com to get your team's access to those tips lines. Lesson 8, manage compliance with policy. There has been many policy decisions over the past year around COVID-19 safety, mandatory vaccination, accommodation policies, and health and safety policies such as work from home and harassment policies. It is important to carefully craft any of your policies according to specific requirements to your business and complying with human rights and other statutory obligations. We have seen an increase in the number of challenges of mandatory vaccine policies and health and safety policies, starting with Johnson Controls. This employee was a technician performing maintenance work in the hospital. At the start of each shift, the employee attested that he was experiencing no COVID symptoms, according to the attestation form. However, he had symptoms, and when tested, he tested positive for COVID and was eventually terminated. So this reinforces the importance of making sure that you have processes in place to help your employees to understand the importance of complying with health and safety protocols and reporting appropriate symptoms in a timely manner. In Ontario, Power Generation versus the Power Workers Union, this arbitration released in November 8th, 2021, challenged the mandatory vaccination policy. This policy had a rapid test alternative for employees who were unvaccinated or who refused to disclose their vaccination status, and the policy was found to be reasonable as long as the employer covered the cost of rapid tests. Through progression, the United Food and Commercial Workers Union of Canada versus Paragon Protection Limited, that this security company mandated vaccine, and after a majority of its client sites required security personnel to be vaccinated. So the arbitrator found that Paragon's mandatory vaccination policy was reasonable, although they still needed amendments for Human Rights Code accommodation needs. And so it was reasonable because Paragon's clients required that vaccination. An Electric Safety Authority and Power Workers Union released November 7th, 2021. The employer's mandatory vaccine policy was found to be unreasonable. So despite some client sites requiring vaccinated workers, the ESA presented no significant evidence that the third-party obligation created substantial problems for its operations. So the ESA indicated that that employer could attend without placing their client sites at risk. A recent Bunge decision pushed the law on mandatory vaccination another step forward and found that mandatory vaccination with no testing alternative was reasonable on South property, despite no third party required vaccination on that site. So this was the first decision to fully endorse an employer's mandatory policy without amendment and without alternative for frequent testing. Wow, eh? So what does it mean? Make sure that you've set policy based on the newest and the latest decisions. Think thoughtfully to determine your reason for your policy and consider work-related issues, locations, clients. Is there increased risk? Follow the policy consistently. But most importantly, have your policy reviewed by your legal resources prior to implementing them so that you can ensure that it's appropriate for your needs. Number 9 lesson, provide accommodation. So even with policies in place, it is important to consider appropriate and reasonable accommodation. Make sure that your accommodation procedures are clear, precise, and that you have educated employees on their responsibilities for accommodation requests. We've had numerous discussions around appropriate accommodation and reasonable accommodation in the workplace over the past year. Because employees have been working from home through that year for other reasons, should they still be able to work from home once you go back into the workplace? What is the job? What are the job demands? Each of the decisions that we have made and the support that we've given have been based on the individual circumstances. So importantly, you want to have a clear step for accommodation. What are the roles and responsibilities for each of the parties with respect to participation in that duty to accommodate? Have you got appropriate forms, appropriate assessment support, information from the healthcare provider that is reasonable to provide appropriate accommodation in the workplace? Is your plan written? How long does it apply? And are you reevaluating to ensure that it is effective? Our workplace accommodation assessments have been very effective in supporting employees with complex concerns around return to the workplace, around being able to perform their work with respect to mental health concerns, cognitive concerns, and COVID-related concerns and immunity. Our occupational therapists provide a clear functional assessment of the person's functional abilities, job demands, and we do objective functional testing to be able to determine what accommodation is reasonable to help that employee return to their essential duties of the role. Our success has been phenomenal, and We thank our customers and our clients for the very positive feedback that we've been getting, that in 98% of situations, employees and their managers have appreciated the work done on the accommodation process to make sure reasonable accommodation has been put in place. We have occupational therapists across Canada, and so check us out if we can support you in any specific accommodation decisions. Make a referral for accommodations, staying at work, virtual, ergonomics, or mental health support and training. And I know I said there was 10 lessons, but lesson number 11 is join our membership. We opened up a membership in October 2021 for select customers to be able to join our network of employers who are receiving regular webinars for training and CE credits, employee videos and handouts and tools on important topics like hybrid workplace, ergonomics, anxiety, burnout, and accommodation. They have access to consultation with our experts on a monthly basis and many different bonuses like 25% off our workshops. We are opening our membership once again in March. And so we encourage you to investigate that if you are an employer that wants access to information that will help you to keep your employees healthy, productive, and supported in this new workplace. So join us, join our membership, and watch for emails about our membership opening up in March once again. And get social with us. Join our newsletter and blog. If you have not, make sure you've signed up for it so that you get our weekly blogs, information about ergonomics, accommodation, return to work, and mental health, and how to help and support your employees in their success in your workplace. Now, as we finish today, I'm going to go back, hopefully, to see if I can ask for take a look at the chat box. Now, how do I do that? Let me just take a look at any concerns. Let me just, there we go. Okay, so I'm going to take a look at the chat. So, is there any questions? If you'd like to put some questions into the chat box. One new message. Thank you, Angela. Eye opener, hopefully an eye opener for everyone that we need to really take a look and support. I'll allow people to unmute if they need to. Any other questions? Heather, I like your comment, making the complex simple. Do you have any recommendations for tools that can help to make this happen? Well, Heather, each of the situations we know are complex, are individual, and are based on your policies and procedures. So my recommendation is to make sure you have very clear policies, processes, and tools in place for stay at work and return to work. And then look at systematically going through that process to be able to ensure that you have the right information to support employees and that they know what their roles and responsibilities are through the process. Most of the times when we see things are complex, then what we see is the concern that emotions get in the way. Sometimes the stakeholders have different agendas. But if you have a clear process and objective assessment to support you from our occupational therapists, then we can help you through those accommodation processes. Happy to talk to you, Heather. Electronic tools. Is that what you were thinking? If only we were dealing with robots, that would be so easy. We do use a number of virtual and electronic tools in our assessment, but what we find is the most effective for solving workplace issues is very individualized and requires some good clinical reasoning. And so our occupational therapists have been trained to be able to work through that in a very productive way. Sabine, what is the cost range of a workplace accommodation assessment? That depends on the complexity or the question, but I'm happy, Sabine, to provide you with a quote. So what we do is when we are arranging for accommodation assessment, we have a quick conversation about what you're looking for, and we can provide you with a very specific quote for your accommodation assessment needs. And so it ranges anywhere from 10 to 15 hours of work, depending on the needs that you have in your workplace. But happy to do an individual assessment and a quote for you. Any other questions? Thank you so much for taking the time again on Zoom to get educated about what we can do to help and support you and what you can do to keep your employees healthy and productive. We look forward to helping you through any of your questions. And so as you continue, if you have any questions, contact Gowan Health at gowanhealth.com. Here's our number as well that you can give us a call or go to our website and do the contact us, and we would be happy to talk to you about what we can do to support you in your workplace. So stay healthy, stay productive, and we'll get through this together. Thank you.